We are happy to have our facilitators speak to about STIs. Short for, okay, let me not really go or allow our speaker to delve into the topic proper. But I just want to say I'm excited to see us here on the call. It's such a big blessing to have us here. All right. You are going to have value for your time. And I promise that by the time you are leaving, you would have learned a lot from our speaker. All right. So today, our first session, we're going to be having Bettina. She's a certified nurse, a midwife in Namibia, and engages in so much activity that help in the health sector in her country. So so excited. I said before, there's so much value to receive here. So I'll be handing over to Albertina to speak. Yes, all right. So I'm handing over to her now, and the next voice that will be speaking to us. Before she starts, I would like to start with an opening prayer. I hope that's okay with every one of us. I'll be starting with an opening prayer, and then I'll hand over to her. So can we just take a short prayer? In Jesus' name, Lord, I want to thank you for this opportunity to learn. Thank you for this opportunity to see transformation in our continent, Africa. We'll be able to make good use of it to further transform Africa to become a better continent. In Jesus' name, amen. All right. So Albertina, over to you. Thank you.
Yes, thank you, Sir Solomon, for this opportunity. I'm really grateful for this opportunity. Am I audible enough?
Yes, you are. Yes, you are.
All right. Thank you so much for this opportunity. I'm going to bring out this presentation. My name was already presented by Mr. Solomon as our chair. So let me just reintroduce myself again. I'm Albertina Abiata, a registered nurse and midwife from Namibia. And I will be giving this presentation about dealing with STIs in our communities. Because most of the people are suffering in silence. They don't know what to do, and it's like a taboo. They cannot talk about such things. Some people went through certain situations that they ended up getting such STIs, and they don't know what to do. Mostly, these things lead from it's a problem from the grassroots and spread to the entire community, which means it needs multi-sectoral integration for it to be resolved. It's a social issue. So dealing with it, let me start first by saying what does STI stand for. It's a sexually transmitted infection that includes HIV, gonorrhea, syphilis, and you can name the rest. So it's actually between partners who went through sexual intercourse. Well, dealing with sexually transmitted infections in African communities requires a comprehensive approach that includes prevention, education, and treatment, as well as support services. So there are some key points to consider when we are approaching this social issue. In number one, we have education and awareness. We have to create awareness campaign to combat STIs in their transmission, prevention method, and the importance of getting tested is very crucial, because most of the people, they don't come for testing. Only one individual come for testing while that person is having a partner or partners, if I have to say so, which means that this part is really crucial for everyone to be tested for STIs with their partners. Even if you are coming for treatment, it's a must that you become with your partner. Yes. This can be done through community workshops. We have to make school programs, outreaches, and media campaigns. So, number two, if one find themselves in such in a very sketchy situation of contacting an STI, they have to access healthcare services. I don't know if in other countries in Africa, people have free access to free health services, but in my country, everyone have free access to health services. Yes, to ensure that communities have access to STI testing and treatment and counseling services. This includes establishing STI clinics, mobile health units, and outreach programs to reach remote areas. So especially remote areas is very crucial because most of the people are suffering not only STI but other health-related issues. Because some of these parts of the countries are really suffering from social exclusion. They are mostly not involved in most of the good services due to maybe there are no roads there or no electricity. So most of the services, it's very difficult for those people to get. So it's our role as leaders to come up with ways to amend this issue. Yes. Am I audible?
Yes, you are.
Yes, thank you. Number three, we have prevention strategies. I always tell my students that prevention strategies is number one. When we are giving health education in our communities, and also there was something which is called ABCs, like abstain, be faithful, and condomize. So that is a point number one, prevention strategies for STI. But for those finding themselves in sketchy situation of STI, we encourage them to use condoms, promote safe sex practices, and provide information on how to reduce the risk of contracting STIs. So this can also include promoting regular testing for high-risk individuals. There are many high-risk individuals to contract STIs in our communities. Yes. Point number four, partner notification. In my country, there's something called a partner referral. When we encounter someone with STIs, it's not the individual problem, it's actually a partner problem. So we gave a partner notification for them to show up at any health facility to get treatment because their partner was also treated or was tested positive for STIs. So that is how we are going to deal with it to combat this social issue in Africa. And this help a lot in preventing the infection to spread, because some of those people who have multiple partners, they will tend to have spread the infection in the community, which is not good. We need to educate our people about this problem so that we can tackle it and combat it. Point number five, we have stigma reduction. Well, when we are talking of STIs, I mentioned HIV and AIDS and STI. So some of the people in the community, it's like a taboo talking about these things, but the people are really suffering in silence, as I spoke it in the beginning. But stigma reduction, we have to do it from there. As leaders, we need to prevent this. We have to address the stigma associated with STIs. It's very important to encourage individuals to seek testing and treatment through without fear or judgment. Because maybe most of the people, when they come to the hospital, they will come telling you different stories. Some will tell you that I went with the wrong girl or I got shocked. So we already know we already know that people are already suffering with from these situations, and it's not a taboo to us anymore. So our leaders in our communities need to inform the community that the nurses or healthcare workers are already aware of the situation. The people must not be stigmatized when you are going to seek for healthcare. So this one, we also do it through campaigns in the communities, creating awareness in the campaigns. Yes, point number 6 is integrating of services. The integration of these services, like in my community, in my country, there are some facilities that are already catering that to the public. So integration just involves whereby a healthcare individual, or let me say a nurse, is treating or giving all the services in one place, or let's say in one room, to say so. If someone who is coming to start ANC, they can just come and start ANC. In that, they can just go in the queue, and then that nurse will be giving all the services. Like if someone came with STI, they treat. If someone came to start ANC, they give everything. So that's how integration operates. So it really requires human resource, because if you might be seeing a lot of people, and it depends on really on the type of facility that a nurse can do integration, but it does help in situation where it used to be done. Yes. Number 7 is data collection and monitoring. Every program, every health service that we are doing, we need data. We need data on STI prevalence rate, treatment outcomes, and other relevant indicators. Like in my country, we are really failing because we don't really check the treatment outcome for these patients. It's our role and responsibility as leaders and nurses or doctors to come up with to make sure that all the cases that we found, they are treated and we had an outcome with, that this person is cured. So, for example, if you find someone with syphilis, you start them on treatment. The moment the person completed treatment, you have to retest for syphilis again. You take an RPR, and then you check if the person is cured or not. So those are the things that we need to look for, and other relevant indicators that can help in monitoring the effectiveness and intervention, so that you know that this treatment, it has worked for this person, or it hasn't worked, I need to change the other treatment, or maybe they are allergic to this. Maybe one person, you even, for example, you give doxycycline, for example, in a healthcare, it's a drug used to in the treatment of STIs. For example, you give doxycycline, and that patient reacted when they went home. They will never come back like, those medication I got there, they really got me very bad, so I don't think I will go back. We must always tell our clients that if you see any reactions or maybe allergy, you need to come back to us, so that you will be sure of your treatment outcome. Yeah, so these are the things that we need to check for data collection and monitoring. Well, point number 8, collaboration and partnership. So we have to work with government agencies, NGOs, healthcare providers, and the community. So that's why I said it's a multi-sectoral approach to combat this social issue. So in the community organizations, we have to coordinate effort addressing STIs. Collaboration can help leverage the resources and expertise to reach more individuals. So, for example, there are those NGOs that can even like provide, they can provide even support with even, let's say, condoms. perhaps they can sponsor those ones, because I know some of in my country, I don't think we produce those. So those are the things that we need to look for when you are combating this social issue. Because like in my country, um, the STI burden is very high. So this is a time to look for help, to help the people at the grassroots, because it's not only on the grassroots, even it's a national problem. Because some of the people, because they are suffering stigma, because they are maybe high professionals, because that's why I used to tell my students and fellow colleagues that just because you are educated now, you're becoming a nurse, you have more information. Just remember that someone who haven't gotten any health related knowledge, they don't know what is happening when it's come to health, unless you inform that person. Like there could be a counselor suffering somewhere, counselor, you could be a president suffering from a certain illness. Sure, if we did not tell them this information, they will not become aware, and they will suffer in silence because they are prominent people in the society and so forth. So for us to combat this social issue, we have to contact NGOs and others for a collaborative approach. All right, number 9, cultural sensitivities. Sensitivity. It's a taboo in certain cultures to mention some certain of points when it comes to STIs. We have to consider cultural norms, practices when designing an STI intervention to ensure that they are culturally appropriate and effective in the African context. So the in some culture there are certain words which are not spoken. So for you to explain that procedure, or to come up with that policy about, or treatment guideline or something about STIs, there are some other words that you need to know how to pronounce them in the certain culture, because the moment they see that word, they will feel like they are not valued, or they are not there, or they are insulted or something. So that's why we have committees for facilities. Health facilities have a committee. So in the committee, you have to involve people from that culture, from all the cultures, so that you cater for everyone. Yes, I hope you understand what I'm trying to say there. So in the conclusion, by implementing a multi-phased approach that includes these strategies, our African community can work towards reducing the burden of STIs and improving the overall sexual health of their populations. Thank you very much. I hope that was very educated. I just want to ask if there's any questions right now. Any questions?
All right.
House?
Thank you so much, ma'am. Um, yeah, chat previously. Let me check if I think someone was
Mm-hmm.
probably making a question or so. All right, Angel Dodo.
Mm-hmm.
So how can we consider cultural norms when this STI awareness?
Mm-hmm.
Can you see it in the
When do we?
chat, ma'am?
Yes. I'm not on the chat.
Okay, the question says, how can we consider cultural norms? Probably if Angel Ododo is on the call, can you probably
When do we?
unmute and ask your question directly so that our speakers can have context?
I got the message. I got the question. Say I
All right,
got it on the message. All
all
right.
right, all right.
When we are considering cultural norms, there are different cultures and beliefs in Africa, right? So every culture have its own culture and norms. So there are certain things that we do in health that they are against a certain culture or norms. Let me just give an example. Like in my culture, there is a tribe uh, that they don't bear twins. If they bear twins, they will rather kill those children so that they will not, because they believe something happens when they give birth to twins. You understand? So cultural sensitivity is like when something is like a taboo in that culture, or maybe it will cause discomfort, or they will think that they are not respected, or they feel that they are being insulted. So whenever we are making something about even like STI campaigns, we have to. That's why I said we have to involve community leaders or maybe representative from all the tribes so that we know. And when we are going to review that awareness campaign point or awareness, promotional, health education, promotional activities, we have to include all the people from different tribes so that we know that it's catering for everyone. I hope she get what I'm trying to say.
All right, I hope so too. If she's on the call or he's on the call, the person can actually unmute
Um,
to
Okay. Hi, hi everyone. Good evening.
yes, yes, evening.
speak. Thank you. Good evening.
Okay. So the question really was how exactly I understand what you said, but how exactly can we, sensitize, tell people about STIs when our culture using it, tell people about STIs, in the cultural way, especially when those cultural norms frown against telling people. Okay, so let me go like this. Like sex
Mm-hmm.
education. Yeah. So
Mm-hmm.
right now you're going to tell people about dealing with STIs. You say, okay, for you not to end up with STIs, you need to use like preventive measures. You need to like use birth control, condoms, and all of those stuff. And now we have
Mm-hmm.
like cultural beliefs, cultural plus religious norms that frown
Mm-hmm.
against sex education. Do you understand? So what are we going to do at that moment? As a leader, as a person, what do you do? What do you do at that moment? I
All
hope you
right. Yes. Thank you so much for the question. It's a very good question. Well, in such case, when we are giving out the information about this social issue we are discussing today, some people, yes, they have religions norms and cultural norms, but I always advise that it's always good when you give it in a local language. You don't have to explain it in a most of the people when they are talking in you involve, like I said, you have to involve people from different similar problems. Unfortunately, you have, when the community
I'm sorry,
Albertina,
Albertina,
sorry.
your your network is breaking, so we can hardly hear you. Are you with us, Albertina?
Can you
I
hear
think
me?
our speaker is having network glitches. We can hardly hear you. All right, Albertina, what you can do for us, can you probably log out and find a better network position that could help out? Probably 1 minute and few seconds for you to do that. Meanwhile, that's a very, very serious. I would not mind getting contributions from others. So Angel Dodo was asking that we talked about, or our speaker spoke about, one of the ways of attending to um, the issue of talking about STIs is that you can talk about it to communities. What of situations where the culture itself seems to bar the action of talking about STIs? So what can we do in that situation? So I think that's a very serious question to ask. And our speaker was trying to answer that, but she's having serious network issues. So I'll still give the room for other people to probably respond while she tries to rectify her network and come back. So I can see more. Oh, someone raised her hand and dropped it again. Mafia, Mafia and Blessing. All right, so let me have Mafia first, then Blessing will go next. Mafia, you can speak.
Yes. Good evening, everyone. My name's
Good
Mufia
evening.
Nombet.
You're welcome.
I just want to contribute to where, like, the question that our sister asked. Normally, cultures, yes, we have cultures that have those limitations. Say, no, you cannot talk about such, you cannot talk about such according to our culture. But the truth is, whatever we encounter, like, this topic is very important because this is the fact on the ground. People are having sex, and out of sex, they are getting those STIs. And if we say we should not talk about these things because the culture doesn't allow us, we are going to have a lot of people dying, a lot of people getting sick. So I feel, according to the culture, there are limitations that the culture can go, and also people that are sensitizing can go. I'll give an example where you are in a Catholic church. Catholic church, they do not allow the use of contraceptives and everything. But if you are in that workshop, you are you want to tell people to say you can actually use such things. You can just say, okay, for example, you have been raped, you go to the hospital. The hospital, those health workers, they have been trained to keep a secret. They'll explain to you what is at risk. Once they explain to you, you get to understand, and from that you can actually decide on your own whether to take or not to take. I feel it applies same to STIs. STIs can be dangerous because I've seen my profession. I'm a farm tech. I've seen cases where people feel shy to say, no, you cannot come to a farmer's to talk to a farmer's personnel to say, no, I'm feeling this, I'm having this. They, most of them, they just end up lying unless they observe to say the situation has gone beyond them. Most of them, they feel shy, they don't want to open up and everything. And if you are not careful as a farmers personnel or health personnel, you end up finding that these people, they'll tell you symptoms that they're actually not the things that they are experiencing. If you are not careful, if you do not ask necessary questions, you might end up treating what is not there. So I feel in our sensitization, especially in a case where there are cultures that do not allow people to talk about such things in public, let us advise our people that we are talking to say you can actually go for consultation to the hospital, where the hospital, they have a room that is specifically for such. You talk about those. I do not know about other countries, but here in Zambia, we have specific rooms when you go to the hospital, where if you want to talk about such, you go there and your information, your secret will be kept safe, and you'll be assured to say no, you get the help that you need. The other way is maybe by forming groups for those people specifically affected. I'll give an example, though I will not mention the name because it is against our 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 rules. There's this lady who in Zambia formed a WhatsApp group because she knows that people are affected. She's affected with HIV and AIDS. She's taking drugs. And what she did is to open a WhatsApp group to help sensitize, to tell people to say, actually, taking these medications help you in such a way, such a way, such a way. And most of people have joined that group. I'm sure I'm in the group. I was added by one of my friends because it is a group for people that want to help people to sensitize, and also people that are affected. You make them feel at home. There are a lot of people that are in that group, and it's encouraging because the way she talks about it, like she would tell people to say, no, tonight I'm going to drink at this time, I'm taking this medication at this time. So it encourages them. Even if you are in that mode where I say, okay, me, I've been affected, my world is ending. But if you see that someone else is taking that, is telling you to take, you feel encouraged and everything. You will start taking. Thank you.
All right, awesome, awesome. Thank you so much for that contribution. Very powerful. I think that's a very wonderful contribution. It has broadened our understanding. So I'll still get Blessing to speak, and I think Foster was raising up his hand, but he seems to have put his hands down. But I think our speaker is back on. So before Blessing speak, I would like to get her. She was speaking before she encountered the network issue. If she can complete what she was saying, then we'll have Blessing speak. Apologies, Blessing. Can we just have a better complete what she was saying before she went off the call? Albertina, can you still hear us? Are you still with us?
Yes, I can hear you clearly now. Say sorry for the inconvenience
All right.
that was caused by the network. So yeah, thank you very much, Mofia, for your contribution. I bet that have answered the colleague question that he asked. Because when you are entering the people with the different cultural sensitivity and all, you have to, they must know that the issue that they are having, they are really going to be helped at the facility. Because most of them are just suffering there, they will not go to the clinic unless you have to convince them and say privacy is assured when you go to the health facility, and you are going to get the help that you need. You will get cured from the infection that you are having. Because most of them, they believe maybe it could be a case. They can believe that it's something which is spiritual from a certain community member or something. So they don't really understand that it's something that can be treated with medication, professional medication now. So yeah, thank you very much. Yeah, that's what I wanted to help. Hope it we really answered her question.
Okay, I think can I hear from Blessing too before we round up on that part of the question? Some other people might have other questions too. Question. Blessing, you wanted to say something. Can you please go ahead?
Okay, thank you very much, and good evening, everyone. So, based on the question that Angel had asked, I as well concur with Mafia because I feel like education is key. When people understand why you are doing so, they tend to slowly tune in and eventually they would give in and start practicing that at a later stage. I know at first it won't be easy because there's that rejection and it seems like it's a taboo to other people. But the fact of the matter is, the more they are sensitized, the more they know what is actually happening and the effects that they're going to have later on, they tend to change the narrative. So it also has to do with the change of mindset, with educating them, of course, and making them also realize to say this is really happening, even actually linking them to certain groups, those that can be the actual example to them, so that they can see to say, okay, this is really happening and there's need for change. Like in my country here in Zambia, I can say there's a much difference with people that are living in the rural areas. Before they never used to be family planning methods that were taken by them because they saw it as a like something that's just going to affect them. But with time, you can upload to say, okay, now they've really changed. The narrative has changed, and the people that are there now tend to use family planning methods. And we can say to say there's developments because of such things. So I feel sensitization and education, informing them, giving them the right information really helps. Yeah, thank you.
All right, awesome. Thank you for that. Let me get Foster last. Foster was raising his hands before he. Yes, you can go ahead, Foster.
Thank you so much. Good evening, everyone. Am I
All right,
audible,
good
sir?
evening. Yes, you are.
Okay. So yeah. Okay. I totally agree with everyone. Yeah. It's just a little contribution. Yeah. So based on the question that our sister had asked, so even here also in Zambia, I'm from Zambia. I agree with Mafia what he said. I believe these taboos still perpetuate in our communities. Yeah, even as you sensitize people, there are issues that they consider to be sensitive, especially when you want to talk about sexual issues. That's a very sensitive issue. But all in all, STIs are real, and people indeed are getting these STIs and they're being affected. So I think what we can do as we go to sensitize, we know that in those, especially areas where they are traditional, they follow cultures. I believe from the word go, just like our presenter had said, there's need to indulge or involve the people who are influential, like the traditional leaders. When these people are sensitized enough, I believe it becomes easier because they know their people, and then when they talk to them, it really becomes so easy for you to actually do your job because the leaders themselves are already clear and are aware. So you need to attack the issue, from the leaders themselves, the traditional leaders. If there's a chief, like where I live here, there's a chief. So definitely, when you go to the chief and explain, and then how people are getting affected and how they end up dying, definitely she will look at it and then consider it because you really have to delve deeper when you go to her. You really need to explain everything and how STI is affecting people. And definitely, she will really understand when you come up with all these strategies that health facilities are offering, the Ministry of Health is offering. You find that she will really support it because we have a government which actually preaches about all these things. When you go and explain to her, then definitely she'll come to terms and understand. Then the taboo issue, because she's a custodian of of how the traditional land and how everybody is there. Actually, they follow certain instructions. When the king or the chief says something, nobody objects. Everybody will actually abide by what the king has said. Because if you deny, it means you'll be evicted from the land. Or if not evicted, then there's something that will follow, which will be a grave punishment. And then the other issues, I think we can, the whole point is we need to use the existing systems or structures that are there. Like the issue of the king, you ensure you leave no one behind. You explain, you actually in your interventions, as you go for your sensitizations, you need to ensure that everybody is involved. The church, everybody, let them speak the same language, because for us to be able to overcome the issues of STIs, it needs everybody on board. All stakeholders must come on board. You don't have to leave anyone behind, because if anybody is left behind, even from the initial planning stage of your sensitizations, it means you're going to have a problem, because the same people who are actually who have the problem are the same people with the solution. They need to change their behavior, and the issues to do with behavioral change are very difficult. You really need to involve them from the inception of your interventions. So it's very important when you start everything. People just deny when you go and enforce. No matter how good something is, because you planned it without them, they're not going to accept it. So there's need to involve them from the initial stage so that they understand what's going on. So anything good, but if they'll feel like it's been imposed on them, definitely they're going to deny, especially sexual issues. These are sensitive issues. So you need to involve the influential leaders, the church leaders, the traditional leaders. They need to be involved from the word go, so that nobody is left behind. Everything is made clear unto them. Thank you. That's my contribution, sir.
Thank you so much. Thank you so much. I really love the contributions that have been made. And it still falls back to some of the things that our speakers already said, right? So I'm sure, Angel, you have been able to get, let me list out some of the points I was able to pick from our speakers, our contributors to the question. Number one is that there's need for the consciousness of secrecy, right? Anyone who wants to report their issue of having STIs or the need for help with STIs would want to know that they are safe, that their secret is safe with whoever they are relating it to. I think that was from our first speaker. Can I remember his name now? Mofia. All right. Then, yes. Then another person talked about making use of all the structures that are available. That was Foster now speaking, making use of all the structures that are available, both church leaders, chiefs, kings, and all the structures of leadership available. Blessing also spoke about the fact that sensitization tends to change about something, even though people already have a particular mindset about STIs, and the fact that they should not be spoken about in general. The more we to talk about this perception actually changes. And let me try and draw a point from when our speaker was speaking. That's Albertina, practice in our country about twins, right? And yes. I can remember there was something like that also in Nigeria.
Mm-hmm.
It was stopped by a particular woman called Mary Slessor, right? And I'm sure Angel, I don't know if you're Nigerian, but I'm not sure, right? So you probably
yes,
heard
I am
about
Nigerian.
All right. The stopping of killing of twins, right? So it was someone who came to sensitize people and was able to convince a culture to change their. So when you find it might not, when you say community, it might not be so large of people, and who you just need to talk to and change their perception about certain things. This state can be very influential and can be very helpful in changing perspective and bringing change. It's a very powerful question, Angel. Thank you so much for the question, and thank you for everyone who has contributed. We still have a few minutes. Is there anyone with any other question or probably contribution? so that we can go on. Then if our speaker still has something to say, the floor is.
Yes, if there's nothing, I don't think there's something on my side still. Right now, I don't think I have something to say. So maybe just about other, if I'm welcome to say about other professional development for the youth. If I'm allowed to say something about that, because I'm an optimist person for those who know me, and I'm an advocate for the youth. Right now, I'm a Mandela Washington 2024 fellow. So I'm a Yali alumni, Yali South Africa. So if there's someone who need information and guidance on how to be on to apply for Yali, for those who need that guidance or Mandela Washington. So I'm currently embarking that journey. So we can connect.
That's very interesting. I would like to take you up on that.
Yes.
For probably as many as would be interested. So I'm sure there are going to be many people, even myself, I'll be very interested to learn and hear about that. So
yes.
How to go about it? Should we reach out to you in your DM, or you would like to have a call, an open call for that specific purpose?
Yes, sir. Thank you.
Which I'm saying that there are two options. Would you prefer we come to your DM that's individually, or you would like a call like what we are having now, where more people can be on the call, and then you can speak to as many people as are interested? Which would you prefer?
I think a call will do justice.
Okay, because I'm very sure more people will be interested. So
yes.
We can just create something around that, and then as many as want to, be part of it can join.
Yes, thank you, sir.
Right. So I'll work on that. So hopefully early next month we should have something like that.
Next month, unfortunately, I'll be on the journey, but it depends on my schedule.
All right, I'll reach out to you so that we can fix
Yes.
a very good time that's
Yes,
convenient
sir.
for everybody.
Yes.
All right. So probably I should just throw this in for everyone, as many as might want to contribute. We are finishing 7:30. We started 6:30. It's just an hour program, so we still have, I think, like 10 minutes left. How do we deal with STIs in church settings? I know everyone here probably is a Christian, I believe so. But even if you're not a Christian on the call, of course, you are not neglecting your own, whatever your belief is, right? I just want to ask this question. Church setting, is usually expected in conservative nature of how church setting is, that people should not engage, except they are married, of course. They are not, as youths, young people, they're not supposed to be engaged in immorality and all that, as the church will term it. So how can we help out? Because definitely it goes on even in churches. How do we bring people to the consciousness about STIs, and how that sensitization changes perception? So how can we, with wisdom, guys, even in churches, just an idea or ideas you can give to. I would love to hear from you. Move here. So yes, you can go ahead.
Thank you very much. I feel STIs, back then it was difficult for people to come out and talk about STIs, because I'll give an example of people that live with the AIDS. HIV and AIDS. You find that back then it was like if you have HIV, you won't have access. Like people will start laughing at you. No one can accept to marry you. Like you cannot have children and everything. But with time, things have improved. We have people that have come up with drugs that can be used to prevent the transmission, the virus. So if we can tell people, like I said earlier, say what is important is for us to educate people to say this is actually possible. I was told, though I haven't seen the injection, but I've been told there's injection that has been released on the market to say it's actually safe. Instead of taking, for example, you have been left, or you are planning to go and have sex with someone that is HIV positive. Instead of you taking tablets, say you are going to be taking tablets every day as if you are on ARVs. There's an injection that has come on the market that you can just take for the month. And that if people come to know about it, to say, me, I can prevent these STIs using such, it will be beneficial to the community, because what kills us most of the times is lack of knowledge. People do not know, especially in the rural areas, to say no. If you go out and have sex with someone without using a condom or unprotected sex, you are at risk of getting such things. If you have been left as a lady or a guy, you can actually go to the hospital. You ask for preventive measures. So if we campaign for people to get to know more about this development that are in the hospitals, I'm sure it can help. Because I'll give an example, like your question, it says to people that are like, it's a couple in the church. You find that people make mistakes. In an example of you get STIs, then you know yourself to say, no, you have seen the symptoms. These are the symptoms. This is STI. Then you keep it to yourself because you're scared to say, my partner will look at me and maybe she'll divorce me, blah, blah, all those things. You are not helping, because you end up infecting the other partner, and that you cause more hurt or pain to the other person. So this can be dealt with informing your partner. If your movement hasn't been that okay, you said, oh, me, I had sex with a person I do not know. Talk to your partner. This is what I did, and this is what I'm observing. So give me this period so that I start the treatment. When I'm done with the treatment, we can get back. I can go and test. If I'm okay, we continue. If I'm not okay, you can start these drugs. Then we continue living as a family. Most of people do not know to say you can be married to a married woman who is HIV positive, and you as a man, you are not. So we need to sensitize more about such. The other thing is, maybe when we talk about people that are married, they have this issue of not being honest to one another, and thinking maybe the community want to welcome them, maybe the friends. So it's more of like, if we can tell our maybe more couples to say, not everything that happens in a marriage or in a couple should be brought outside. Certain things you can just keep them, because it is our friends, some of our friends, that we tend to tell things, and those people will bring distraction to ourselves. So if me, I know that I have STIs today, I just tell my wife, then my wife decide to keep that information, I get treated, then we continue living. No one will know about such. But if I tell my wife, then my wife go and tell the friends tell the friend. It means it will bring confusion, because those friends will start saying, just leave your husband. This is what it is. This is what it is. So we need to know whom to tell and whom not to tell. Thank you.
All right. Awesome. I'll get Foster's point of view just now, but I just wanted to see, while I'm an advocate actually for even abstinence in the first place, like if you're not married, completely abstain. I am very conservative. And then if you are married, remain very faithful to your partner. That's my own belief and everything. But I'm also very conscious of the fact that sometimes mistakes happen, like you're just saying now. Mistakes usually happen sometimes people make errors, and out of their own weakness and inconsistencies, they end up doing certain things that are not should not have been done. So in those cases, like the points you have raised, I think become very necessary. And that's why even in a church setting, we should not shy away from talking about these things, right? So thank you for your contribution. Yes, let me get from Foster last. We just have 2 minutes left. Yes, let me get from you, Foster, before we end the call. Are you with us, Mr. Foster? If you are speaking, Mr. Foster, I'm not hearing you. If you are speaking, Mr. Foster, I'm not hearing you.
Hello, are you able to hear me, sir?
Okay, I can hear you now. Okay, I can.
Okay. So just to add on what Mr. Murphy said, I think on how we deal with STIs in a church setting, we know that this is a sensitive issue, yeah. But yeah, like you mentioned, sir, Mr. Solomon, I think church mostly focuses on abstinence. Yeah, we emphasize that point, but we know that young people, is actually they're having sex, yeah, in a church setting. So we can pick it up from what Mr. Murphy said. I think for me, we use already existing structures, because we know that, like here in Zambia, STIs are more high in the young people. And I know in these church settings, there are structures, there are youth structures where they tend to have health talks. So we can take advantage of actually that. Also, so that we can speak to the youth, but not really leaving out the older generation, so to say. Yeah, we can pick it up because there are workshops that other partners actually run, in line, yeah, together with health. So we invite also church leaders. Yeah, like I mentioned earlier, pick it up from the church leaders, sensitize them first, and then now they'll allow us to come into church. Because definitely, there are issues to say, mostly, yeah, others would say, okay, yeah, we are prayer, would use prayers, but prayers, yes, will actually save you from demonic attacks. While contraceptives, yeah, so to say, are condoms, they will actually save you from the physical disease. So those two must be separated. So, because the thing when Mr. Murphy was saying, he reminded me of actually an issue where we have these papas, prophets, prophetess who tell people stop taking ARVs when they're actually HIV positive. And later on, you find that the condition exacerbates, it gets worse. By the time they try to retain, it will be actually, way worse. But, we should also emphasize actually in these churches to say, even if you are prayed for, you continue taking the medication, not until you go and have a taste, so that you see that you are totally healed from everything. So I believe when we are to follow the existing youth structures that are already in the church, we take it up from there, and then we invite these leaders maybe for workshops when there are meetings and there are workshops for various stakeholders. We just bring them on board, discuss these issues, and then see how, because the church definitely it preaches a lot about abstinence, but being human beings, young people having sex, the reason all these issues like STIs are coming out and affecting people so badly. And nobody can worship God if they are not healthy. It means everything gets actually affected in their lives. When they are not healthy, it means they cannot even go to church and worship. They actually, the membership will even go down in these churches. So we try to link all those points together. You find that, yeah, issues will be ironed out. Also, we emphasize on the issues of confidentiality, privacy, because people, there's this self-stigma also just to access services that, okay, they know us, that, we worship God, and then now when they see us at this place, they'll say something else. But we emphasize on issues like Mr. Mofia said, confidentiality and privacy, it's actually key. Nobody discloses all these issues. I think when we take it up from there, I believe even, we can approach issues from that angle in terms of the church. We can come up with interventions that work actually within the church and for the church structure. Thank you, sir.
All right, thank you so much. It's really been an awesome session, and I've enjoyed every bit of it right from the beginning up till now. Thank you, Miss Albertina Abieta. We really enjoyed your presentation. Thank you for taking out time to create your work and help us out with it, so it could be presented, and then for explaining it to us, and then helping us to think deeply so that we can talk about some of the issues that we just spoke about this evening. So tomorrow we're going to be having the final session. Please let every one of us remember the same time tomorrow. We're going to be live, and I hope to see every one of you tomorrow. So excited to have every one of us today. Hope to see every one of us tomorrow. So thank you so much. I'll end this meeting with a closing prayer, and then we can exit the call. Lord, I want to thank you for this evening. Thank you for everything we've learned. Thank you for our speaker who've used to impact us this evening. And thank you for everything that has been passed across. Thank you for the questions. Thank you for the answers that we've received. We pray that you help us to make good use of everything we have learned to impact society in Jesus' name. In Jesus' mighty name we have prayed. Amen. All right. Thank you, everyone. I can see Foster, I can see Mofia, I can see Cindy, Martin, Laston. I can see some other names that are on the call. I appreciate everyone for being, part of the meeting this evening. I'm so grateful. For some of us that I don't know particularly, I will reach out on WhatsApp. Right, anyone whose contact I don't have, I'll reach out to every one of us and try to get to know every one of us. So thank you so much. We can exit the call. Hope to see you tomorrow. Thank you. All right, Mr. Foster was asking of the presentation. I'll send it to or Miss Albertina will send it to the group. I'll ask her to send it to the group so that we can all access it. Yeah.